Good morning. Welcome back to Open Med School. I am Dr. Andrews, Professor of Medicine and Consultant Neurologist. Pneumonia is very common and ABG is routinely done in severe cases. Today I will be discussing the interpretation of ABG in patients with pneumonia. So let us start with a case. So history of a 45-year-old patient who presents with fever, cough and shortness of breath. His SpO2 at room temperature was 90% and arterial blood gas analysis was done. So here you can see the area of consolidation. The ABG shows pH 7.3. So the normal pH is 7.35 to 7.45. So it is decreased, so the patient has got acidemia. So how will you interpret? So first step is evaluate the pH. So pH is 7.3, I have already told, normally 7.35 to 7.45. So the patient has got acidemia because the pH is less than 7.35. Next step is assess the carbon dioxide. Here the carbon dioxide is 50 millimeters. What's a normal? Easy to remember, 35 to 45. So it is a pH is 7.35 to 7.45 and the carbon dioxide is 35 to 45. So the carbon dioxide has increased. So this you can say patient has got a hypercapnia. So increased carbon dioxide is called hypercapnia. So patient has got a acidemia plus increased carbon dioxide. So this increased carbon dioxide has produced the acidosis. So this is respiratory acidosis. Next step is evaluate the bicarbonate. So here the bicarbonate is 24. Normal bicarbonate is 22 to 26. So this is normal here. 24 is normal. So this means there is no compensation has occurred. Next step, we will be assessing the SpO2 or SaO2 and PaO₂. The PaO₂ here was 60, normally should be more than 80. And the SaO2 and SpO2 was 90, we expect more than 95. So this patient has got a hypoxemia. So the patient has got a hypoxemia plus hypercapnia. So this is what is called the type 2 respiratory failure. So the patient has got a type 2 respiratory failure, hypoxemia plus hypercapnia. So now look at the clinical context. What is the reason for the hypoxemia? The extensive consolidation has led on to decrease in the gas transfer and that has produced the hypoxemia. How will you explain the hypercapnia? Normally in pneumonia there is an increase in respiratory rate that will wash out the carbon dioxide. Here the carbon dioxide has increased. This probably due to the fatigability of the respiratory muscles that has produced the decreased respiratory drive that led on to increase in the carbon dioxide level. So what is the final diagnosis? Patient has got acute respiratory acidosis with hypoxemia and hypercapnia. And what is the management? We have to give oxygen to correct the hypoxemia. You can give nasal oxygen or non-invasive ventilation if needed. Treat the underlying condition, that is consolidation, with antibiotics. And the patient may need intensive care management.